My main takeaway is that it's never too early to bring your child in for assessment. So even if they can't verbalize or read the chart, I can still assess whether they have myopia by dilating their eyes and doing a full cycloplegic refraction. So that's something that parents don't know. And the earlier you diagnose the myopia, the quicker you can start on treatment and prevent progression from rapidly progressing. So it's something that parents may not realize, but it's at any point they can bring their child in for an assessment.
More and more parents are being told their child is short-sighted or myopic. At the same time, many adults who've grown up with myopia are now asking, did I have other options, and what does myopia mean for my long-term eye health? In this video, we're going to unpack what myopia actually is, who gets it, why controlling it matters, and what modern eye care can do, from childhood treatments right through to adult vision options. I'm joined by Dr. Linda Zheng from Eagle Eye Surgeons. Linda is a laser refractive and ophthalmic surgeon with advanced training in pediatric ophthalmology and myopia management, including international experience in Shanghai, the global epicenter of myopia research and treatment. But first, for those who don't know me, my name is Paul Salloway. I'm the founder of Optics Digital. We help eye care professionals to grow their practice through patient education and connection with their communities. So, hi, Linda. Good to meet you.
Good to meet you, Paul. Thanks for having me.
So would you like to tell us very briefly about your backstory and maybe your career path that got you interested in myopia and that led you to joining Eagle Eye Surgeons in Sydney?
So I was around 8 years old when I first developed myopia myself. So I have a personal experience with this disease. And so since childhood, I've been, wearing glasses and then ortho K. And then since early adulthood, I've returned to glasses. One of the real reasons why I became an ophthalmologist was because I had myopia. And in the period in which I was growing up, laser eye surgery became, a treatment option. And so that really, drove my decision in medicine to then direct my efforts towards becoming an ophthalmologist. So it's always been really close to my heart, myopia management as well as laser eye surgery. Incidentally, during my ophthalmology training, there started to become there was like research that came out about treatments for myopia, and that was so for me, that was so enlightening because, this is an area that, I suffered from in childhood. And now we have treatments that we can provide for similar children to myself to basically slow down their myopia progression and make them, candidates for laser eye surgery. So I've done the full continuum. I've, been in ortho K as a child, and even before we knew that was a myopia control method, and I've had laser eye surgery myself as an adult. So to me, this is a special interest of mine because I've suffered through, the continuum, and I've also treated myself, and now I have perfect vision after laser eye surgery. So it's really, a special interest, but also a driving reason why I entered ophthalmology as well.
So you have a real, personal experience. You can speak from your own personal experience with all of these things.
Absolutely.
So Linda, let's start with basics. So what is myopia, and why does it seem like so many more children are being diagnosed with it today?
So myopia, the best way to say it is short-sightedness. So that's like for a child, it's when the vision in the distance is blurry, so that they can still see okay at near, but over time it gets blurrier and blurrier to see things in the distance. And this is because the eye normally does grow as the child grows, but myopia is when the growth exceeds normal growth, and so the eye grows too long. And so when the eye focuses the image, the lens focuses the image, the focal point is in front of the retina, and therefore the patient cannot see the distance vision. And corrective lenses like glasses and contact lenses basically refocus the light at the retina that's now a bit further back. The rates are really increasing globally. They're saying 50% or more of children will all have myopia. And it's, there's a combination. There's genetics. My parents both had myopia. So, I developed myopia. Also, screen use, like nowadays, we've got iPads, TVs, iPhones, a lot of near work for children from a young age, and also less time outdoors. So, because of the competition in school, children are going to tutoring, they're, not going outdoors as much as when in the past when there was a lot of sporting activities and being outside all the time. These are all contributing factors to myopia, for the incidence of myopia as well as progression of myopia.
So when you say the growth or the elongation of the eyeball, you're saying like from front to back, from the front or the cornea, that part of your eye to the rear, it actually is becoming
Correct.
more elongated as the child's eyeball grows, right?
Correct, yes.
Okay. So what age would children sort of start to see myopia affecting their vision?
So normally it starts around school age. So I'd say between 6 and 10. It's good because it's an age where the child can verbalize, mum, dad, I really think that thing in the distance doesn't look very clear. And it is so important at that point in time to bring them in for assessment to check to see if they have myopia. I've also got kids who've, presented a lot earlier. So I've had the youngest child I've had with myopia is probably around 2 years old, and I can start management at that age because I know how to do cycloplegic refraction. So the child will not even need to talk to me for me to know what their power is and to start treatment. And so I feel like it's, that's obviously rare. Most of the time it is in a, school cohort, but, it's getting younger and younger. I'm seeing younger kids with myopia, and the younger that they present, the more likely they're going to get higher degrees of myopia and it's going to progress faster. So it's imperative in those populations that they get treatment as soon as possible and be regularly monitored and assessed.
Hmm. Okay. So who gets myopia? Like what are the risk factors? From my understanding that there's a genetic component to it and there's also an environmental component to it. So can you sort of speak to those two things?
Yeah, so my time in Shanghai really showed me the genetic component. So, a lot of Chinese parents are myopic, and the higher their myopia, the more likely that their child is going to develop myopia at an early age, and also have similar degrees of myopia or myopia that exceeds their parents. So genetically, parents with myopia it is a risk factor, and it is very obvious to me that the kids that do progress fast often do have parents with myopia. Often one or two parents. The other thing I've noticed a lot is kids, who spend a lot of time on their screens, doing a lot of reading in the dark. So I see kids that, love reading their books in the dark. That's really, can cause myopia progression and development. And also kids who just really don't go outside very much. They don't get natural sunlight. They're often indoors studying, tutoring, school. And this is like interesting because in China there was a study. So during COVID, myopia progression and incidence increased because everyone was inside. So this something like a disease like COVID has shown us that during periods of lockdown, myopia does increase, and so it is directly correlated to sunlight as well.
So, okay, so it's partly genetics then.
Mm.
So if you've got parents who are myopic, then that increases the odds that you yourself will develop myopia. Do you think like the built environment that we live in plays a role? Because I'm thinking like in Australia, I think generally maybe we spend a lot more time outdoors than in some places, like maybe China. So how does that have a role, do you
Absolutely.
think?
Absolutely. I feel like overall we're quite blessed in Australia because we have a lot of sunlight here. Australia is quite warm, very sunny. We do have less myopia, and the power that, like, so for example, the degrees of myopia is a lot less compared to China. In China, I was looking at, -15, even -20 patients with such high myopia, whereas in Australia, to be a -8 is already quite high. I often deal with, myopia, underneath that range. So we are lucky in the sense that our environment is conducive to reducing myopia progression in Australia, and so prescribing 2 hours of sunlight is very effective in Australia because we have great sun. So getting the kids outside is one of the treatments that I suggest.
I feel like that's a bit of a double-edged sword in some ways, though, because we're always telling kids like to be careful in with UV rays and like protect their skin, protect their eyes. So I think there's kind of a balancing act there,
Ab-
isn't there?
Absolutely. Well, I would suggest like children can go outside, but also wear sunglasses. Like you still get enough sunlight from that, but also protect your
Yeah.
eyes from the UV rays.
Okay. So sunglasses are absolutely fine then as
Mm.
as part of that outdoor exposure.
Absolutely.
Okay, so why then? Why is it important to control myopia? Because I know a lot of parents are going to be thinking, well, okay, so my child just needs to get stronger glasses every few years. Why is that a big deal? So, but there's actually a lot more to it than that, and there are longer term implications, aren't there? So, would you like to talk about that?
Absolutely. Absolutely. So if you think about it, as the myopia increases in power, the eye elongates more. So the eye sclera, the white bit outside the eye, gets thinner and thinner as the myopia gets higher and higher. And so I say that over the power of -6, they're in high myopia territory. And in that
Mm.
territory, anything greater than -6, you start developing ocular complications. So these include, myopia increases the risk of retinal tears and retinal detachments in the future. It also increases the risk of myopic maculopathy. So, damage to the center of the vision from overstretching, and also, growing blood vessels because it's very thin. So they get wet macular degeneration quite early and quite young. I also have seen, glaucoma. You get open angle glaucoma in highly myopic patients, and they often have this quite young as well. And cataract as well. So, a lot of ocular conditions can be, correlated with, having high myopia, and the stretching of the eye makes it, susceptible to this.
Mm. Okay, so that elongation like actually impacts the structural integrity of the eye itself, and can lead to like problems with the back of the eye, with the retina, that type of thing.
Correct, correct. So it's really important. That's why myopia control is so important from a young age, to be, assessed, monitored, and kept within a safe range of myopia as well.
So what you're saying is, for children who develop high myopia, there is a risk like later in life, like as they get into their, like later decades of life, that they really are possibly going to face some serious health implications there.
Correct, correct.
Okay, well, if you're watching this on YouTube and you're getting value from the discussion, please do us a big favor and hit the like button. It really helps us with the YouTube algorithm and increases the chances that other people like yourself are going to get benefit from this information. Okay, so all right, so we've talked about what myopia is, and we talked about the risk factors, or who is likely to get it, and we've talked about why it's important to control it in the long term. So how do we control myopia in children and teens then? What are some of the options for slowing down myopia?
Yeah. So interestingly enough, as I said before, when I was a child, I used Ortho-K, and I didn't know back then, and there was no research into this, but now there is research that Ortho-K causes like a peripheral defocus effect, and that slows down myopia progression. Other treatments that include, so low dose atropine. So that's, clinical studies have shown that differing concentrations of low dose atropine can help slow down myopia progression, and this can be tailored to your child. And special myopia control glasses. So these are what we call peripheral defocus glasses. And there's also new ones coming on the market, like, dot glasses, as well as, varying technologies that are coming on. And it basically causes a peripheral defocus, and the dot lenses, I think, cause difference in contrast on the retina, and these have been shown to slow down myopia progression. And the third, treatment on the market at the moment is for, recalcitrant myopia progression that doesn't respond to all of the previous treatments. There is red light therapy, which involves, twice daily sessions of 3 minutes of red light therapy to the retina. That basically increases choroidal blood flow to the eye, and that strengthens the sclera, the white bit of the eye, so it stops growing as long. And that's very effective. It's definitely very effective, but it does need to be monitored closely. So children need to have regular, macular scans and fundus checks to ensure that, it's not affecting their eye health. So far, the evidence has been, fine, as long as there's no other ocular with that treatment. And so, yeah, there are so many treatments now, and, there's more and more research, every year. So as time goes on, there'll be more and more therapies. I'm hopeful that we're going to keep everyone as a low myope, so that they can all get laser and not have any, major ocular comorbidities.
I've heard some optometrists talk about combination therapies where they might use atropine
Mm.
plus myopia control glasses, or plus atropine plus I think there are contact lenses now as well, aren't
Yeah,
there? Like,
there's also MySight contact lenses that are peripheral defocus. Yeah. So actually, combination therapy is how I usually manage my children, because I want to make sure that they can see well, and when they get their correction, like either glasses, Ortho-K, or MySight contact lenses, that I want to put a bit of myopia technology, control technology into that. And at the same time, I also then give them, low dose atropine, and I titrate it based on their tolerance and their growth. So I always do combination therapy because I feel like it's most effective. Obviously, if children cannot tolerate the combination of the two, I sort of, tailor it to what they can tolerate to, have the least amount of progression.
so just a random question. Does nutrition play any role in myopia? Is there any sort of research around that?
So far, there's no obvious, nutrition that can make myopia, slow down or not progress. But I assume just a good balanced diet for your child with good fish oil, good
Yeah.
vitamins, that in itself will be good for ocular health, which will be good for myopia as well.
All right. So, so if you're an adult now, and maybe you had some degree of myopia when you were younger, what are the options now? Like, assuming that your prescription is stabilized, what are the options of actually, getting back good vision?
It is so exciting. I've had laser eye surgery because in the last few years, the technology has just, advanced so much to make laser eye surgery incredibly safe and incredibly effective at, achieving perfect vision. So, nowadays, I'm an expert in SMILE, which is small incision laser eye surgery, which only involves like a 2 millimeter incision. But also, I can do LASIK, which is the traditional form of laser eye surgery, PRK, which is surface laser eye surgery, as well as ICL surgery, which is implantable polymer lenses. And that's for patients with high myopia or patients who do not have the ability to undergo laser eye surgery. They can have a lens inserted in front of their natural lens to correct their myopia and be glasses free. So there are so many different types of procedures that we can do to treat myopia now to allow patients to be glasses free from the age of 18 onwards if their prescription is stable.
What about I think it's called refractive lens exchange, where you actually
Mm.
replacing the crystalline lens in the eye.
Yeah.
Is that also an option for somebody with myopia?
Absolutely. So in older patients, so I would say from like 40 and above, 50 and above,
Mm.
and definitely from 60 and above. So from 60 onwards, I wouldn't be recommending laser eye surgery. I'd be recommending clear lens exchange, which basically involves removing the natural lens of the patient and putting in a lens that corrects their myopia. We've got a lot of like technology now, including multifocal lenses, extended depth of focus lenses, and also you can also try a bit of monovision to be glasses free. It's the same as cataract surgery, but in these patients, they don't really have significant cataracts. We're mainly doing the surgery to allow them to be glasses free, and it has great outcomes as well. Due to advancements in cataract surgery and the advancements in the type of lenses we have on the market, you know this area is also becoming really popular, and I'm getting really good outcomes with my patients with these technologies.
One thing I'm a little bit confused about is, like, why would somebody choose an implantable Collamer lens, an ICL, versus just replacing the
Oh,
crystalline lens, the refractive lens exchange? So in both
yeah,
cases, you're doing some kind of eye surgery. So in
yeah.
my mind, I'm thinking, like, why would I choose implantable Collamer lenses when there's also the other option, which is maybe going to prevent me from getting cataracts at some point?
Yeah, it's basically due to accommodation. So before the age of 60, there is the eye still can accommodate, so the natural lens can still focus at near. And so these are younger patients that I recommend have implantable Collamer lenses because then they will have perfect distance vision as well as perfect near vision because they'll be accommodating and their natural lens will be doing that. Over the age of, 60, all accommodation is lost in the eye. So the patient has no ability to focus at near. At that point, having a multifocal lens is perfect because it gives them that ability to focus at near that they would not get with an ICL surgery. And it's
Mm.
also important to know that, obviously the lenses like multifocal lenses, extended depth of focus lenses allow patients to be more glasses free, but they do have some visual aberrations at night, especially like glare and halos. So naturally, if the patient is younger and they still have their accommodation, I would use an implantable Collamer lens because it gives them the best clarity of vision for all focal points. And it also is reversible as well. So if this young patient has decided, oh, I don't really like this ICL, it can be removed and they can return back to their old self. That eye can return back to normal. Whereas if you've done, clear lens exchange, you're committed to having, a new lens basically. So these are all things that's important to discuss with the patients.
Okay. All right. Okay. Now those are good points. So so basically, Linda, you're saying it's never too late for us adults then.
Anyone can have surgery to get rid of their glasses, basically. We have all these different types of surgeries and it's never too late. That's what I get. A lot of people say, I'm too old for laser. And it's important to know you don't have to have laser. There are other options if you don't want to wear glasses. Like Presbyond is now, a laser between 40 and 60 to help get rid of reading glasses. So, people don't even know that. So it's one of those things that, the more that technology improves, the more we can do to, allow people glasses freedom.
Yeah, it's a really exciting time to be an ophthalmic
Mm.
surgeon, I imagine.
Mm. Absolutely.
Well, so Linda, I think this has been incredibly helpful, especially for parents who may be feeling a bit overwhelmed or unsure about where to start with managing the health of their children's eyes. And before we finish, I just want to mention that Dr. Zheng also speaks Mandarin fluently. Is that right?
对，我可以讲普通话，如果你们需要我在做门诊的时候，可以跟你们讲普通话。
I'm going to have to guess what that means, but thank
Yeah.
you.
Yeah, I can do
uh,
an entire consultation in Mandarin if
Great.
needed. So, just to make the patients comfortable, I've also performed my laser eye surgery in Mandarin. So, a lot of my patients, because they're Asian in background and they have myopia, sometimes having their native language is more comfortable when they're having surgery.
All right. Well, if there's one takeaway then that you want families to remember about myopia, what would it be?
My main takeaway is that it's never too early to bring your child in for assessment. So even if they can't verbalize or read the chart, I can still assess whether they have myopia by dilating their eyes and doing a full cycloplegic refraction. So that's something that parents don't know. And the earlier you diagnose the myopia, the quicker you can start on treatment and prevent progression from rapidly progressing. So it's something that parents may not realize, but it's at any point they can bring their child in for an assessment.
And where can people go if they'd like to book an appointment with you or learn more about myopia management at Eagle Eye Surgeons?
Yeah, so I practice at Eagle Eye Surgeons Mosman and I have a myopia control clinic there. So if you just call 7228 3900, just make an appointment to see me. I'm happy to perform a full assessment on your child, as well as if as a parent you're there at the same time and you're interested in laser refractive surgery, it is another, we can also do, one of our optometrists can do scans to see if you're eligible at the same time that your child is getting assessed as well. So we can do, it saves time if, two in one consults.
That's right. Two birds with one stone. All right. Well, thank you. So for anyone watching, if this video has helped clarify myopia and your options, please remember to hit the like button and subscribe to Eagle Eye Surgeon's YouTube channel and follow along on social media for more trustworthy eye health education such as this. So thanks again, Linda, and thanks everyone for watching.
Thanks, Paul. Thank you so much. Bye.
See you next time. Bye-bye.
Bye.